COVID cases in Meghalaya may peak by next week amid the ongoing 5-day lockdown in Shillong and weekend lockdown in place in other district headquarters. The Conrad Sangma government is getting ready to tackle a further rise in COVID numbers in the days to come. Speaking to the media, Meghalaya Principal Secretary Health Sampath Kumar said the state may see its COVID peak next week. Kumar added that the situation is dynamic and may change.
Regarding the peak actually, we will see the peak in 1 week, at least in the state. The way where actually peak means where there will be a breach. Breach means basically where your capacity is this much and you're actually going beyond the capacity. So you shouldn't go to that level. That's one thing. That's why this containment is so important. That's what I was being mentioned. So generally, if you look at it, I think unless this reproduction rate, what I said, which is currently at national level, it's over 1.5. So unless this reproduction rate is below 1, this will not fall down. So the reproduction rate will fall down only through the mobility lockdown. So essentially the containment measures. So that's something that we need to look into it. Of course, the data will come. It's a very, very dynamic, I can say that one, because we cannot actually predict for a longer period, because currently if you look at it, it's actually speed.
Well, Meghalaya is seeing a steady increase in COVID cases since April, and this time around it has taken the state a very short time to reach 1,000 cases. Kumar observed that on an average, the state is witnessing over 250 cases on an average every day since the last 1 week, stating that the containment measures are the only way to slow down the virus. He expressed optimism that the lockdown measures would reduce the virus. Asking people to be responsible for themselves and wear masks, he cautioned that the new strain is very infectious and spreads faster. When asked about the preparations in hospitals, he said that the government is taking steps to enhance all the requirements, but admitted that there are limitations.
Each one is responsible. Each one should feel that, if they don't wear mask, potentially they can actually cause problem to others. So that responsibility should be there. So that's one of the things. Is like containment includes like a proper mask wearing. We're also saying that mask wearing is a proper mask. Wear a proper medical mask, a surgical mask, or wear a double mask if you are wearing a cloth mask. Add with some 3-ply surgical mask. So through that actually we can really contain the virus, and at the same time, this containment strategy also should go even take a pledge. We need to take a pledge that we will if each one of us actually follow that one for at least next 14 days, that I'm going to very diligently follow this one. So that actually reduces significantly a lot of spread of this disease, because this particular strain during the second wave is in fact is very infectious. It has been reported everywhere across the country.
Meanwhile, opposition Congress MLA from Shillong, Mahendra Rapsang, has slammed the state government over the alleged lack of resources in state to deal with the COVID situation, even after spending crores last year. The West Shillong MLA slammed the government, saying despite spending crores, it has not been able to set up a dedicated COVID hospital so far. Rapsang alleged that not a single district is ready to tackle the pandemic.
First, the government said we are ready, we are still last year, April last year, 2020. The whole year they've been telling us, we are ready to cope with this pandemic, we are ready. But now, look at the situation now, they are not ready. Not even a single district is ready. Thank God Shillong is there, but Shillong also, everything is full, hospitals are full. What's going to happen? After spending 400, 500, 600 crores, we are ready? I don't think we are ready yet. With this infrastructure which the government was planning, that we are ready, I think we are not ready. There are shortage of beds who are serious patients or COVID serious patients. There are no space for them. So we have to look ahead now. What are we going to do?